Well, welcome, everybody, as the participants start to join in on our panel. Today's panel challenges regulating the tobacco industry. It's part of the Hopkins Business of Health Initiative's monthly webinar series, Conversations on the Business of Health. I'm Dan Polsky, director of the Hopkins Business of Health Initiative, or HBHI. It's a Hopkins-wide initiative bringing together scholars from across the university who share a mission to advance health through affordable and equitable, high-value health system. And our focus is on the role of business and incentives in advancing health. So with that as a welcome, I'm going to turn the proceedings over to our moderators and organizers, HBHI experts on today's topic. Michael Darden, Associate Professor, Johns Hopkins University Carey Business School, and Jeffrey Drope, Research Professor, Johns Hopkins University at the Bloomberg School of Public Health. Thank you both for organizing such a great session, and I'll turn it over to you.
Thanks so much, Dan. This is great. So this webinar continues a series of webinars on the responsibility of corporations for the health implications of their business. And in many ways, the tobacco industry really wrote the playbook for skirting responsibility for their products, including misinformation campaigns and in some cases outright fraud. But tobacco is not just a historical lesson in corporate obfuscation. Tobacco still kills over 400,000 Americans per year, and that's roughly 5 times as many as opioid overdose deaths in the U.S. It's a major public health concern. It still is. And while cigarette smoking has declined in the U.S., the prevalence is much higher in other countries. And the emergence of e-cigarettes has made a really challenging policy and regulatory dilemma between encouraging smoking cessation and encouraging and discouraging youth initiation. So from a public policy perspective, we think that the net effects of regulations and policies are going to depend on their direct effects, but also the unintended consequences associated with tobacco industry responses. And that's going to be our focus today, is thinking about how the tobacco industry responds to policy and regulation, and thinking about what is it that regulators and policymakers can do when they formulate new policies. So to discuss these issues, we have a really fantastic panel. We have Henry Waxman, is a former United States representative from California, and among his many legislative accomplishments, Representative Waxman introduced the 2009 Tobacco Control Act, which gave FDA regulatory control over tobacco products. We have Mitch Zeller, who was the director of the Center of Tobacco Products at FDA from 2013 to 2022. We have David Levy, who's a professor of oncology at Georgetown University and oversees the design and development of various simulation models that predict the effects of tobacco control policies. And we have Barbara Schillo from the Truth Initiative, the chief research officer there, which was itself created out of the Master Tobacco Settlement. And Dr. Schillo works to build evidence, the evidence base surrounding tobacco control policies. So thanks everyone for being here. I think this is really exciting. To start, we're going to have a common question for each of the panelists, in which each panelist will take about 5 minutes to respond. And that common question is, what is it that makes regulating or working with the policy side with respect to the tobacco industry so uniquely challenging? And so I'll start with Representative Waxman.
Thank you very much. I'm pleased to be on this panel. And I'm talking to you in a building where the fire alarm just went off a minute ago. And I thought I was going to have to leave before this conference even started, but I'm pleased that the alarm stopped, and hopefully there's no fire. So I will proceed with answering your question. I think when you look at the tobacco industry and its products, they are the leading cause of preventable death and disease in this country, and maybe around the world. And I wanted to do something about this issue from the days when I was chairman of the Subcommittee on Health and the Environment of the Energy and Commerce Full Committee. In fact, I jumped over the senior member to become chairman of that subcommittee when the senior person ahead of me said that they didn't think tobacco was a problem. The issue, however, was that individual came from North Carolina and he was afraid to say anything negative about the tobacco industry. prevailed and became chairman of the subcommittee. We held many hearings on how damaging tobacco was, especially for kids if they become addicted to it. And in the course of our investigations, ultimately leading to a session with the tobacco executives who raised their hands, promised to tell the truth, and then proceeded to lie. They said tobacco was not harmful. They said they didn't adjust the nicotine in the tobacco to keep people addicted. In fact, nicotine was not addictive at all. And then they further went on to say that they would never do anything to keep kids smoking or to get kids to start smoking. It turned out that every one of those statements that they attested to was inaccurate, and they knew it was inaccurate. But with their lawyers, they're very careful to avoid a perjury charge, lying to the Congress of the United States. That was our hearing. It brought up a lot of attention to the issue in a unique way because there were men in suits who were executives or CEOs of these companies who were presumably the people you could trust to tell the truth, and they were lying, and everybody who watched them knew they were lying. That had a dramatic impact. Couldn't pass legislation at that point, but it had a dramatic impact because young kids, who I was mostly focused on trying to keep them from starting smoking, saw this bunch of suits and taking advantage of it. The second thing that led to disillusionment with the tobacco industry was the fact that that we found out that nicotine was addictive, cigarettes were harmful, and if you suffered from smoking because you voluntarily smoked, that was one thing. But if you were involuntarily smoking because you're in the presence of the tobacco smokers, you could also get cancer. You could also get the heart disease and other problems from smoking, which is if you were also smoking. So public places were saying on their own, and later by legislation, we're not going to allow smoking in our facilities. This was brought home very dramatically when we tried to get a law passed as an amendment to say that there could be no cigarette smoking on the airlines. They had these sections, smoking and non-smoking section, although the tobacco smoke didn't know which section it might be in. And when we had the realization that it was harmful to be around smokers, and they were banned from smoking in most facilities, smokers had to go outdoors. And that discouraged a lot of people from smoking. So we had to drop tobacco smoking without any legislation. In 1994, we had the hearing with the tobacco executives. It wasn't until 2009, when President Obama took office, that we were able to pass the tobacco legislation to regulate a product that was completely unregulated by federal law. And we passed that bill, and President Obama signed it. And as a congressman who had authored the legislation, I could breathe a sigh of relief because this was not going to be as it was in the past. FDA was going to regulate it. It spelled out some specific issues that they couldn't do, but we left a lot of it to be implemented by the FDA. Now we're in the long saga of post-FDA. It was a real experience, an educational one for me, to realize how when we pass a law, that's not the end of it. There are a lot of decisions we have left in the past to the regulatory agencies. And we asked the FDA to adopt regulations pursuant to the law. And if anything else came up, another product came up, they'd have to show that any new product, tobacco product, was more beneficial than not having it on the market at all. That became the loophole that left a lot of regulations unpromulgated when the tobacco industry turned to vaping. And now they're turning to other products like Zyn. And they've got these new products. And their argument for the new products is not that you should use these products instead of tobacco. Their argument is you should use these products instead of tobacco because it was less harmful. But all of these new products have one thing in common. They're addicting people, particularly kids, to the drug nicotine. And it's a delivery system for nicotine. Now, the head of the FDA, at the time we got all these revelations of manipulating nicotine, David Kessler tried to regulate tobacco at the FDA because he said, this is now, we know about tobacco, it's a delivery system for the drug nicotine. And he promulgated regulations to deal with that. It was a lawsuit that went all the way to the Supreme Court. And the Supreme Court said, no, you can't do that by regulation. You got to have a law to be passed. So our law was even going to be more significant. In the meantime, from 1994 to 2009, the Republicans were in charge of the House of Representatives. The man who called the shots as to what bills would be brought up and voted on was Tom DeLay. And Tom DeLay was a strong supporter of the tobacco industry, even though he's from Texas. But it wasn't a local Texas product. It was the product of money that he was able to get from the tobacco industry. It was a leading funder for the Republicans' election campaigns in the House. And he would not allow the bill to be brought up during that whole period of time. As an aside, he was later convicted of a crime, and he had to go back to Texas to deal with this accusation. And he flew back to Texas in what we call air tobacco, one of the tobacco companies' planes. He was their champion, or one of their many champions. So they gave him a ride back to Texas on one of their planes. Just a little gift you give to friends, and he was certainly one of their friends. So in 2009, we adopted the law, and we're still waiting for the FDA and the department to do some of the things they should be doing. The Republicans were in charge of the House and kept the bill from coming up, but Democrats were in control of the administration, and they would not do anything about vaping because they didn't know whether they should or they could. And I argued that if you can't take these products off the market, don't let them use these flavors, because that's what's getting kids to use vaping. And they wouldn't take the flavors off. I remember when Sylvia Burwell, who was the secretary of HHS, said to me, isn't it great we have the deeming rule enforced now? I said, yeah, but you didn't do anything about flavors. And she walked away, and that was the end of it. But she wouldn't do anything about flavors. But President Obama was concerned about it. Some of his political people were concerned it could hurt him in the next election. Similarly, now we have had President Biden, and his FDA was trying to regulate the menthol in cigarettes, which the FDA had clear jurisdiction because we kicked it over to them. They're the health group. They're the regulators. They'll do something about it. They were proposing to ban menthol cigarettes, but then the Biden people said, oh, no, this could be a problem in the election campaign. So they backed away. It's a lack of courage on the part of a lot of elected officials that we have come to the point now where we have these products that are quite dangerous, delivering a drug that's addicting, and it is causing an enormous amount of health. The other thing we have going for us is that a lot of the kids and adults are smart enough to know they shouldn't be touching these products. I always thought our key to stopping the damage from tobacco was to stop the appeal to kids, to stop kids from smoking. Now we have the whole world turned upside down. The argument is the main thing we got to do is to help the people who are already addicted by giving them a product that is not as dangerous as cigarettes. Well, we got to tell them how to give up smoking, not how to become addicted to a new product. And that's what we have with vaping. That's what we have Zyn. That's what we have with these other things that other tobacco companies are working on. So it's a failure of the policymakers to do all the things that we should have been doing and still could be doing to stop the ravages of tobacco on the health of the American people.
Thanks so much, Henry, Dr. Representative Waxman. So, well, let's kick it. Let's go to Mitch Zeller for your perspective on this.
Well, I think Congressman Waxman has done a great job of explaining the political environment in two different branches of government. The challenges of what it took, but he was the champion. Even though from the time of that Supreme Court opinion to the time that the Tobacco Control Act passed, it was basically another decade, which meant 5 million more deaths in the United States. But eventually the Tobacco Control Act under his leadership was passed in 2009. But I think he very rightly described the political reality in the executive branch. And unfortunately, as center director at FDA, I saw firsthand what he described in the Obama administration. And so I guess the one war story that I will tell is to pick up on what Congressman Waxman was referring to as regards flavors. The deeming rule, just to level set for everyone, the original grant of authority only gave FDA jurisdiction over cigarettes, smokeless tobacco, cigarette tobacco, and roll your own tobacco. But in its wisdom, Congress had this clause called the deeming clause, which said that FDA could go through the rulemaking process to deem other categories of products that met the then statutory definition of a tobacco product to be within its jurisdiction. That's the rule that the congressman was referring to that became final in 2016. The behind the scenes story was that FDA wanted to take all flavors out of all newly regulated products. And let's just say that we didn't have the support to do that from HHS and the White House. And so the rule that we put into the clearance process is not the rule that emerged at the end of the clearance process. I can only speculate as to the degree to which politics were an influence. I think it is the most likely cause. To fast forward to the Biden administration, I retired in 2022, but got the Biden administration to support banning menthol in cigarettes, banning characterizing flavors in mass-produced cigars. And 2 months after I retired, they announced their support for reducing nicotine levels in cigarettes and other combustible products. With menthol and cigar flavors, they had the courage of their convictions to at least put out proposed rules. And as we all know, there never have been any final rules. And I would say it was highly likely that it wasn't because the White House had questions about the science. I think that it is far more likely that similar to the challenges that the congressman faced in trying to pass legislation that took the better part of a decade to happen, the Biden administration caved to political scare tactics from the tobacco industry. And I can tell everybody on this webinar that when I was there and trying to get their support at the proposed rule stage, I laid out every single argument that the industry was going to make. And I laid out how baseless the arguments were surrounding policing and illicit trade. And I had persuaded them with my colleagues at FDA, at least to the point of getting them to support the proposed rule. But that was before they started hearing directly from the industry and from members of Congress from tobacco growing states. And sadly, I think that the Biden administration blinked and caved into baseless political scare tactics from the cigarette companies. And it goes to the issue of, have they really changed? Yes, they now have a more interesting array of products along the continuum of risk. And yes, they're in the business of selling less harmful products, no question. But when push comes to shove, the cigarette companies have a vested interest in opposing a menthol ban, opposing nicotine reduction, opposing graphic health warnings on cigarette packs, which on our cigarette packs are a laugh compared to the kind of warnings that are available on the packs in other countries. Sadly, maybe the industry isn't as politically influential as they had been 40 or 50 years ago. But they're smart, they're shrewd, they know how to use their support on the Hill. And sadly, the proof of that is how the Obama administration caved on flavors and how the Biden administration caved on menthol and cigar flavors.
Thank you. Thank you so much. Dr. Levy, let's go to you.
Okay, great discussion so far. I'm glad to be part of it. As many of you know, most of my work now is on modeling, which feeds directly into policy, and a lot of that focus is on cigarettes versus e-cigarettes, now other products, but also in the area of other risk factors, alcohol and obesity. Another part of my research, which I feel is important because of its orientation, is looking specifically at industry behavior. And some of that focuses on industry strategies, discounting and so on, which I think are very important, but also on industry dynamics. And what I mean by that is how competition does or does not work. And that's important. And I think it's important to also distinguish between the period pre-2010, when, quite frankly, my models, I think, predicted quite well. I had confidence in their ability to predict future trends and the impact of policies. But a lot of that is because it was clear there was a focus on the cigarette industry. Granted, there was smokeless and other issues abounding, but there was a cigarette industry that was highly concentrated, an oligopoly, and could be characterized as implicit collusion with a leader, naming Altria, which made them particularly effective, I think, at lobbying and influencing regulatory policy. But it was clear who was the quote-unquote enemy, and the areas of marketing were relatively confined. The industry was relatively well-defined, and very importantly, most of the product was sold at retail, where they had an advantage, much of which is due to slotting allowances, where they buy shelf space and effectively keep out other companies. So they were in, I think, a unique position of power. Do they still have power? Undeniably. But post-2010, things are much more complex, and my model predictions are much more tentative. And in particular, we don't see just the three or what was 4 or 5 leading cigarette companies, but we've seen a major role of independent companies selling various products, making things more chaotic and difficult, in a sense, to regulate. And then also important in terms of where we're at now is the entry of Philip Morris. And why is that important? It's unclear what their impact's going to be, and I could talk more about positive and negative aspects, but clearly they are in competition with Altria, and potentially in a way that improves harm reduction. Why? They do not sell cigarettes. They see an important opportunity, in my view, to cut into and replace cigarette use with their major products, nicotine pouches and heated tobacco products. We also, an important part of the post-2010 is continual new products. I mentioned nicotine products and heated tobacco products. An interesting term coined by the economist Schumpeter is the process of creative destruction. Now, that's an interesting term and can be viewed in many ways, but what it does mean is it makes it more difficult to regulate the somewhat chaotic scene. And finally, an important difference is whereas there used to be a focus on mass market retail and also tobacconists, we now have two additional sectors. And what's important there is, at least in mass market retail, we have 7-Elevens, there's more local reputation and that kind of thing. Now we see vape shops, and they also sell marijuana, and there's less, I think, of a tendency for them to be concerned about reputation. On the other hand, potentially they have served some positive roles in terms of getting people to switch from cigarettes to less hazardous products. But most important is the advent of the internet, which is an important source for products, but it's also a very important source of information. And in all this, I think what's important is not only looking at the variety, the different policies, but the different patterns of use. In my view, the focus should still be primarily on cigarettes, not to disregard the other things, but also on disparities. In other words, we see certain arguably disadvantaged groups that are the predominant users of cigarettes and also having the greatest health effects. So just to summarize, again, let me turn to an economist named Frank Knight, who distinguished between risk and uncertainty. Risk is when you can define probabilities relatively accurately. Uncertainty is when things are simply, as put in a simple way, constantly changing and more difficult to predict, which is an issue because the FDA is in a position where they regulate products through PMTAs, and so they're put in a position to approve or not approve products subject to a highly uncertain environment. Is there a solution to this? I think that it is important to develop standards, and I see that as important to the future regarding content, specifically related to harmful outcomes, potentially standards for nicotine levels. I'm a strong supporter of nicotine reduction, limitation on types of flavors. I think a menthol ban is particularly important, and flavors need to be regulated in some way for other products, although it's less clear how and how that can be done and which type of flavors should be regulated, and focusing on marketing. So my basic recommendation is policy needs to be clearer, more focused, and enforceable. Right now we have products out there that are not legally sanctioned, and we need to make sure that policies are enforceable so that we could gain more control over the more chaotic aspects of the market. Thank you.
Thank you, Dr. Levy. So, Dr. Schillo, would you like to go?
I'm going to try to be brief because I know we want to continue the conversation, and everybody, my fellow panelists have really opened up some great places for us to kind of springboard to. But I will say, as the Chief Research Officer of Truth Initiative, whose mission is to prevent youth and young people, prevent addiction among youth and young people, and empower quitting for all, I'm coming at this from this perspective, and I hope we can talk about that soon, in particular, sort of that tension between e-cigarettes, youth, less harmful products for adults. I will say, and again, I know that we'll have more conversation about this, that I think it's important to put out there that protecting youth and helping adults are not competing priorities. They are shared responsibilities essential to advancing public health. And as we look at the complexities, I totally agree with Dr. Levy on the complexities of the marketplace and regulation moving forward. I think that's just an overarching piece for all of us in the field to consider. I do want to just go back though to, I'm not going to talk about, I'm not a politician, I have never been a regulator, so I'm going to talk a little bit about a couple of historical and continuing aspects of the industry that make them particularly uniquely challenging in terms of regulation. So there are certainly many commercial determinants of health, impacts on society. It's four industries that account for a third of global preventable deaths, with tobacco leading that list. But what sets the industry apart from many other commercial determinants of health is that, and makes them uniquely challenging, is that they are selling products that are addictive and really have no societal value. And I think, just to be brief here, I'll jump right to the other thing that makes them they have been and will continue to be challenging to regulate, because they have a long history of actively opposing public health policies that we know reduce the harms of tobacco and nicotine. And we see that opposition to public health policies only increasing, not decreasing. Last year, they had registered lobbyists in all 50 states, and that intensity and that level of lobbying only increased, not decreased from the prior year. And so, of course, part of the discussion today, I think, will be whether or not has the industry changed? And they have in some respects, but I will argue strongly that a corporate rebranding campaign that positions themselves as champions of public health and science and crusaders for the environment is not that proof. I think we know that the industry continues to use the same playbook, evolving slightly, to a changing marketplace, but they are expanding product portfolios, marketing new products, trying to change the narrative to improve their reputation, and, as I mentioned, lobbying and cultivating influence with policymakers that are actively against policies that strengthen those tobacco control efforts. So I'll just maybe leave it at that, other than to say that, I think that it's important to underscore that the factors that brought tobacco under the regulation of FDA and CTP still loom large and are not to be dismissed. And I'll just make one last point, which is I think, to build on maybe something Dr. Levy said, which is I think it's important for us to continue to monitor what the industry is doing and understand that, and also educate younger generations of scientists and public health practitioners that didn't live through all that history, all that great history that we heard from Mitch Zeller and Congressman Waxman.
Thanks so much, Dr. Schillo, and thank you to all the panelists for actually a very cohesive set of remarks, I would have to say. There's a lot of agreement here. I want to press you all on something, and I'm going to just sort of set up this question and pose it to all four of you. And this is going to build on something that Professor Levy put forward about the changing structure of the tobacco industry. So we went from an oligopoly that was led by one particular company was the lead, but it was an oligopoly, and it's shifted, and we have a more diffuse industry now with more companies, more products, and it's awfully confusing. And it's interesting because I think we always looked at the oligopoly and said, oh, it's so hard to regulate the oligopoly, and now we don't have it anymore. It's changed. It's still oligopolistic probably in some ways. But now we're looking at this differently structured industry, and it turns out it's really hard to regulate. So it's careful what you wish for, I suppose. But I hear all three of you talk about real policy solutions that are on the table and really sound realistic. And the science that's been generated to support these is really convincing. So things like flavor bans, obviously these flavors are problematic in terms of attracting youth to tobacco products of all kinds. This idea of nicotine reduction that has been introduced and has been, I think, really well researched, and I think we have really promising results from that research suggesting that it is really quite a possibility in terms of mitigating consumption of tobacco products. And then one other thing that actually Professor Levy mentioned was the problem that we have in terms of controlling marketing and other channels that we didn't have before. We could control radio and television and magazines, but suddenly we're inundated with TikToks with people smoking and vaping and using nicotine pouches. And this is a really tough thing. It's not impossible to regulate these things. We know that they regulate pornography and other things within these internet channels. So I guess I put out to all of you as a looking forward at this now vast and more complex industry. How do we push the envelope, at least in maybe these three policy areas or any additional policy areas that you think might be realistic and actually could pose a solution? So over to you first, Mitch.
Thanks. Obviously, it's a complicated question. I want to make a general comment about the industry. There isn't the industry. The major players are in competition with one another and are different. I'm not going to call out companies by name, but let's just say I think some companies are more committed to the pivot away from the most harmful products than others. In litigation that's been brought against FDA, there are some companies that didn't join the litigation. The litigation against our graphic health warning rule. One of the major players sat it out. Now they stood to benefit perhaps from the work of their colleagues, but they had an opportunity to join the case and chose not to. But some things never change, even with the remarkable heterogeneity of products that are in the marketplace today. And I think that putting independent companies aside that are only in the business of selling non-combustible products, so let's put them aside, because the major players in the market are in both camps, and I think are horribly conflicted. They see enormous profit from continuing to sell cigarettes. They're selling a product that is purposely designed to create and sustain addiction, and they have a built-in customer base. Even with historically low smoking rates in the United States, we still have 30 million smokers. And that's a lot of money for the companies, regardless of the diversity of their portfolios, their product portfolios. And so some things never change. Just a couple of months ago, there was a report of yet another product liability lawsuit brought by the family of a dead smoker. This is in 2024, not 1964, not 1974. In 2024, in yet another one of these cases, the lawyer representing the cigarette companies argued to the jury that it was her fault that she got sick and died. He argued before the jury that she was concerned about her health, she wanted to quit, and 5 minutes after any quit attempt, she started smoking again. That was the cigarette companies in 2024. So the question for all of them, even given the differences that I concede exist between some of them, is what do you want to be when you grow up? And what is it going to take for you to be no longer in the business of selling a product that you purposely designed to create and sustain addiction, and that you know is going to kill 1 out of 2 of your customers long-term later in life prematurely? What's it going to take? Because apparently, when it comes to being a defendant in a product liability lawsuit, nothing has changed in the last half century. And I don't know what it's going to take for it to change. I do know that the tools of regulation, when used wisely, with the right kind of political support, which so far has not been present, to do what we needed to do on flavors and the deeming rule, what the Biden folks should have done on menthol and cigar flavors, and more work on nicotine reduction. If the political will was there, if the courage was there, as you've heard other speakers say, the science is there to support the further policy approach to reduce the death and disease from the most harmful products, while we sort out what to do about everything else.
David, go ahead.
Go ahead, David.
Dr. Levy.
So yeah, no, I agree with much of what Mitch said, and I would point out that if you look at recent data, you see that marketing expenditures per cigarette have actually increased. At least this is not FDA but FTC data, and it's pretty clear up through 2022. It's a fairly steep uphill climb since, interestingly, about 2010. So you could kind of see, and these are specifically marketing expenditures on cigarettes. So you could see where the cigarette industry is. At the same time, what's the cigarette industry, it kind of is in a good position because right now they have the e-cigarettes with PMTAs, which in my view is kind of scary, but at the same time that puts them very strongly against the disposables coming in from China, which I think from a public health point of view, disposables, I think, are potentially the most harmful and the most addictive and the most child-oriented and flavor-oriented of cigarettes. How do you stop that? Unclear, but that, in my view, that needs to be a focus. So, I'll leave it at that, but yeah, I mean, these are all very difficult issues that we're facing now, but we need to focus, in my view, on cigarettes and maintain the drastic reduction in youth cigarette use, while at the same time addressing the still high rates of cigarette use of those among age 40 and above.
Jump in. I absolutely agree. And I think I'll offer 3 recommendations to do that, again, with the focus on youth and young adults. So, we do have authorized products now in the marketplace, 34 e-cigarettes, and then the announcement was in last week. So, the FDA and the industry alike and retailers must be held accountable to ensure that these products are marketed and sold responsibly. So that means strict oversight to prevent youth access, protect our nicotine naive young people, and uphold the progress that's been achieved, just as David said. I think Congressman Waxman hit this from the start. We have to address the appeal of flavors to reduce youth initiation and subsequent addiction. From the beginning of time, flavors have been the hook that have brought young people in. And so they're certainly there in e-cigarettes. We just need to be cognizant of how that is an umbrella over all tobacco products moving forward. And then totally agree on the disposable side of things. These disposables that are all illegal are bigger, stronger, cheaper. It's the name of an article that I worked on with colleagues, and are designed to attract young people. And now we see them going beyond just these big, strong, cheap vapes to the gamification with smart vapes. And so I look with hope and anticipation for more of these actions on the part of the FDA in terms of seizures and significant monetary penalties. I think the FDA, I hope the FDA will continue to take significant action to address this part of the market in particular. But I think all 3 of those things are important.
Representative Waxman.
Yeah, thank you. I'm very interested in what others have said about this issue, but if you think about it, we've really got ourselves in a topsy-turvy situation. Who would have thought that we would embrace the approval of products that do so much harm? I always thought and said that if cigarettes were first being introduced and we knew what harm they caused, they would be banned, but we couldn't ban them because so many people use them. Prohibition didn't work for alcohol, it wouldn't have worked for cigarettes. So we tried different ways to deal with it, get reduction of use, and to get people to shun it. But we thought that regulation by a scientific agency like the FDA would be the answer. But if you look at the record of the FDA, not just in their wimping out on flavors and the menthol rule, it took them forever to finally do anything. The flavors were already in these vapes, and they were on the market, and the market was growing bigger and bigger and bigger, and FDA didn't act. FDA didn't act because they were slow. I don't think it was intentional. I don't think the industry insisted they take their time, take longer than need be, but they were slow. They were not a strong regulator, as we hoped they would have been. And then the courts made it even harder for them to act. So we are in a situation where there's still an attraction to get kids to use these products. There's a prevailing view among many that if you took the nicotine out of cigarettes, then they would go to these alternatives like vape that are less harmful. But these products are still harmful. You need to not introduce new harmful products and then encourage people to use these new harmful products. We've got to wake up to the fact that there's a responsibility on the part of government, executive and legislative, and on the part of the population, that we need to inform them of the harm, stop it from happening by regulation, and then not rely on the legal court system to compensate people, because even there, cigarette smoking has not been reduced as much as we hoped it would be through private litigation. So we've got our hands tied. We needed a scientific agency like the FDA to look at the science, not the politics of it, make the decisions that would accomplish the goals that we all agree need to be accomplished, and have the courage to act, not to have these things drag on for so long in such a weak approach to regulation.
So speaking about bans and banning some of these products, I want to come back to the menthol issue because this is something that a number of panelists have brought up. There's a lack of political will. There was a caving of the Biden administration. But Professor Levy, so you're in the business of forecasting, right? You're in the business of trying to predict what will happen, and you have a paper thinking about this menthol ban. So I have a question for you, and then for the panelists generally. If we ban menthols, in your model, or more generally, what assumptions do you make about the response of the tobacco industry? So so these products are banned. Maybe they move on, they divert resources from the production of menthols to something that's worse. Maybe they market in different ways. Maybe they ship out to China and they come back through ports in the United States. What modeling assumptions do you need to think about when you think about the industry response to such a ban?
Ooh, that's a really tough question. Yeah, I mean, what we do predict is two major points. That a menthol ban will get some smokers to quit. And I think those are immediate effects. Those are good. And I'm talking about quitting all primary nicotine use. Some will switch to e-cigarettes, which I think is important and will help thwart, I think, young people from starting to smoke as having an alternative. Not that that's the most desirable, but I think that will happen. And I think the cigarette companies will promote that. In terms of, yeah, I mean, the problem is still, imports, lack of ability to control imports. What will the cigarette companies do? I think it's going to vary. I think some companies are going to fight it much more than others. Reynolds, now BAT, is I think more invested. Others will be less. I mean, Philip Morris is going to see that as an opportunity to promote less harmful products, namely nicotine pouches, which I think are probably the least harmful products, but heated tobacco products, which are like cigarettes and most profitable to cigarette companies. I think other cigarette companies will move towards heated tobacco products too, because they're proprietary and there's more potential for profits, similar to, maybe not as great as profits from cigarettes.
Dr. Schillo, did you have your hand up?
Oh, just to add, I think we just need to be vigilant and look for the examples of what's happening in states and localities that are passing flavor bans. Two states in particular, California and Massachusetts, which have comprehensive restrictions, including menthol, and where we saw, a pivot to the marketing of new menthol cigarettes in these states, or new non-menthol, cigarettes in these states. So these brand variants were advertised with the same green and blue hues, with slogans evoking a menthol flavor like experience of still bold, still smooth. We did some focus groups with smokers in these states, and established menthol smokers hated these products and felt tricked by them. But there was concern that, for younger smokers or younger people choosing a cigarette, they might be attracted to it. And so, I think we just have to always take into account the potential impact of the industry action taken in response to regulation.
Go ahead, Mr. Zeller.
Well, as a recovering regulator, I would much rather deal with the challenges of compliance and enforcement of a menthol ban and to continue to put up with, and pardon my French, the bullshit of the politics of why can't any of these administrations get their act together and give FDA the support that it needs to take the right step in taking menthol out of cigarettes. When the Obama administration recruited, I hate to tell the war stories, but I think they're relevant to what we're talking about now in 2025. The Obama administration recruited me to come back to government in late 2012 to run the Tobacco Center. And I said to them, I'll come back, but you have to give me your word that I'll be able to work on banning menthol and taking nicotine levels down. And we had a deal. I had to start working on a few other things first, like the deeming rule. And they gave me their word that I would be able to work on menthol and nicotine reduction. Did you see any action on menthol and nicotine reduction in the Obama administration? And the answer is no. I tried, but did not get the support, and was told the support would not be there. So it would be great to get to a point where the biggest problem was the things that we've been talking about here, which is what kind of end run will the industry try to do? How can you minimize the unintended consequences of a rule that the real world evidence from Canada projected down to our much larger population says will save hundreds of thousands of lives. That's just the menthol ban. The nicotine reduction is going to save millions, avert millions of deaths. But it comes down to political will. And the irony was FDA made more progress on both menthol and nicotine in the first 2 years of the first Trump administration, because we had a commissioner who had the courage of his convictions. And he, Scott Gottlieb, became the first commissioner of FDA to be on record as saying menthol needs to come out of cigarettes and cigarettes need to have nicotine levels brought down to minimally or non-addictive levels. Ironically, in the Trump administration. Now, sadly, I was then told to stop working on menthol and nicotine after Dr. Gottlieb resigned. But we made a little progress then, 2017, 2018 into 2019. And we thought much more would come from the Biden administration. And while, as I said, they got proposed rules out, they unilaterally decided not to move forward with menthol and cigar flavors. And literally, with just days remaining in their term, put the proposed nicotine rule out. And goodness knows what the fate of that is in the Trump administration. So the political will is missing, and it's desperately needed.
Well, that's pretty depressing, Mitch Zeller. Thank you. But I think probably realistic. I know we're getting close to time here, but I wanted to put something else out into the discussion sphere here, and that is whether or not it's possible. And I've been listening to the four of you give really great comments and ideas and suggestions and paths forward. But one of the things I hear is a little bit of a contradiction in terms of many of these policies, with perhaps the exception of nicotine reduction, and maybe that really is the path forward. But I feel like there's a needle to be threaded here, and that is we have 30 million smokers, as we've heard here in the United States, and we have also heard there's a disparity component of this as well. It is unfortunately hitting specific discrete groups much harder than others. And we need to think about how do we deal with this. And, one of the ideas that's been put forward is for those who can't quit, maybe moving to some of these less harmful, but still harmful, I will also acknowledge, products is a path forward. Yet what we know is those same products are harmful, and they are used as a way to attract young people to using nicotine products. And we worry about this. But we don't seem to have a really good policy solution to how to do both things at the same time. And so I'm wondering if any of you in your parting words can suggest a path forward for us as a society. And I'm going to start with you, Mitch Zeller.
Yeah, let me just state very quickly, one thing that we haven't talked about in this session is good old-fashioned cessation, products, programs, and services to help smokers quit. I think one of the great failures of my beloved agency, FDA, is we haven't had a new authorized medicinal product to help smokers quit since 2006. So something's radically wrong with this picture. And all the politics that we've been talking about on the tobacco side are not present on the drug side when it comes to helping smokers quit. But the regulator needs to be at the table and sending the right kind of signals to sponsors that the door is open in the same way that drug regulators in the United Kingdom have had an open door policy to work with sponsors to come up with basically a better mousetrap. The medicinal nicotine products perform very poorly in the real world because they do a very poor job of delivering the nicotine. The regulator needs to take a public health perspective on this and open the door without weakening standards. And I really think that we can avoid a lot of the politics that we've been talking about here, because it's kind of mom and apple pie, better products to help smokers quit.
I want just as we are getting really close to time, I just want to thank all of the panelists for this wonderful discussion. Congressman Waxman, I saw your hand up, so I'll give you the last word.
Well, I just wanted to underscore the suggestion that we just got from Ms. Zeller. I was stunned when people started telling me, oh, we need to give the smoker a way to quit smoking by still using nicotine. And what about all the other ways to quit smoking? I was a smoker, I confess to you. I gave it up more than once before I finally gave it up. But there are products that help people get the nicotine so that they can give it up more easily. And there may be other ways to accomplish this goal, but to take the nicotine out and force smokers to get their nicotine through an alternative product that they will be addicted to, it's still harmful, never made a lot of sense to me. And we ought to put a greater emphasis on getting people not to take up smoking and getting smokers to give it up. And if we have some products that will help them give it up, not alternative products, but give it up, we ought to put a greater emphasis on that.
I think that's a great last word. So thank you so much to all the panelists. It's been a really great discussion, and I appreciate everyone in the audience for joining us. Thanks so much.